Children comprise up to 56% of Uganda's population. Despite the existence of a child-friendly policy framework, many children in Uganda continue to live in conditions characterized by inadequate access to health services, biting poverty in homes, increased pupil dropout rates leading to low completion rates, and unacceptably high cases of child abuse and neglect. This undermines the four cardinal rights of a child: survival, development, protection, and participation. The Child Protection in Crisis Network facilitated an inaugural 2012 Learning Forum to focus on community-based child protection mechanisms and their linkages with the national child protection systems of Uganda. The two-day learning event was attended by over 70 leaders from government, civil society, international agencies, and academia.
I would like to take this opportunity to welcome all of you on behalf of the Program Learning Group in Uganda. The CPC network is coordinated by Columbia University. It was born several years ago by a number of agencies that had an interest in the welfare and protection of children. It is a network for research, learning, and action. It is a collaboration of humanitarian agencies, local institutions, and academic partners working to improve the protection of children in crisis-affected settings. The CPC network addresses child protection. And child protection, in this instance, it involves preventing, responding to, and reducing the harm caused by abuse, exploitation, violence, and neglect experienced by children. The Program Learning Group, what is it? It works to develop and conduct innovative action-based research to help inform child protection systems, programming, policy, and advocacy.
The retreat provided a reflective space where participants critically examined the viability of informal and formal child protection systems in Uganda, so as to use these experiences to frame new child protection systems development initiatives.
We don't know of any other entity in the world that is able to protect and care for children as well as that happens inside families, even though there are problems inside families. But if you think about the basic origins of protection, it is in what I guess scientists would call that signal-response relationship, and parents just do it naturally. But it's when you pick up your child and you look at her and you feed her and you change the equivalent of her diapers. When she cries and there's a response. Cry, response. It's signal response. When that relationship, the signal-response relationship, goes well, children grow up really with this fundamental thing that they need to take hold of life. Investments in early childhood, research all over the world tells us that this is the best investment the nation can make. One of the most difficult things, I think, for a government responsible for child protection to do is to go to Parliament and argue its case. We need more action on behalf of children in the area of care and protection because they don't have some of the formative data required. And other sectors of society do in some way. So if you're a minister going to Parliament and saying we need to do more for children, we need to do more for child protection children, and someone says, well, how many kids having this problem are there? And you can't answer that question. You've got to be able to identify the problem, you have to be able to quantify the problem, and you have to be able to propose solutions to the problems. So where are we in Uganda as a protection community in our ability to do those three things?
Timoso Kobo is going to present us a report on community-based child protection system, MAPI, a case of Lila and Dokoro in northern Uganda.
In the study, informal child protection systems were defined as any mechanism that is not instituted by or funded by government. And these include families, clans, NGOs, religious institutions, and community groups. It also emerged that community-level actors are responsible for about 85% of the child protection caseload in the districts, while government provides 15%. This basically means that the bulk of cases or issues around child protection are actually more into the informal system as opposed to the formal system.
My general comment I just want to raise is a learning issue. How do we learn? I think it's very critical to understand when we're talking about learning. Is it learning that bringing research findings to practice, or is it also practice influencing research? How do we communicate our learning to the general public and to different actors who are involved in child protection?
The first is really engaging around the systems agenda. I think what we're doing today is part of this process, discussing, engaging stakeholders, making sure it's a nationally owned agenda, that it's a Ugandan agenda, it's the government that's leading with partners, with academics. Then you can start the actual mapping, looking at from vertically all the way down, and having consultations, validating the findings, and finally developing a strategy that has a timeline and you can cost that.
How do we package our child protection to make sure that an economist and the person in Ministry of Finance, the person in charge of the Treasury, can understand and know that allocating resources to child protection is critical.
Unless we change our mind, unless we get out of here and say, come tomorrow, we are going to begin to quantify child protection services and say it costs so much, and if you don't invest then it will cost the economy so much. We are going to keep singing the song over and over again.
From a lot of what we've seen presented so far, there is a lot of response mechanisms, and some of them are aimed at perpetrators, such as the law response, the police response, etc. But what about the work of prevention while working with perpetrators, and how can we see that somehow in the child protection system?
Because this is a learning project. I think we can learn from other countries where they've been able to work with perpetrators of sexual abuse very well. And one of the countries that we can learn from is Rwanda, where they're working with the perpetrators of genocide, perpetrators of child abuse, to really promote positive masculinity.
As the LC level, I already pointed out, there's almost no documentation. If you go to most of these LCs, they've referred hundreds and hundreds of cases, but they've not documented. You can invest a lot in children, they know what to do, they know where to report, but there is a lot of frustration for children when the system is not able to respond. And we've talked to children who are sensitized about their rights, about reporting mechanisms, and they are very frustrated with us because when they went there, they were not helped.
Secondly, room for us to work with the children, to conscientize them, educate them about what they can do to protect themselves and to avoid or minimize the chances of abuse happening. One area where I know there is room for improvement is making the locations, the various locations that we use more child-friendly. We know what happens in most health centers, in many other locations where we expect children to be able to report.
One of the things that this has been a great conversation, but we need to link what we've learned together in systems, and so that's the point of my conversation.
The delegates also engaged in group discussions and identified the lack of visibility of children in need of protection in terms of data and the lack of funding to support research and building empirical evidence. Among the conclusions reached include the need to recognize child protection as a sector in its own right, but must be closely linked with other sectors. There is need to map formal and informal child protection systems and integrate child well-being indicators into the Ugandan National Household Survey instruments.
It also came out very clearly that ministry or government should be a strong coordinator and ensure that we move in a unified manner. It also came out very clearly that investment in early childhood development is one of the most important investments. It also came out that we need to address the workforce question, the issue of having specialized and adequate workforce to ensure that children are protected is also emerging as a very important area.
In any case, these mechanisms have been there, and they are the ones that have saved us. They are the ones that through which we have been able to achieve the little that has been achieved. So I'm saying, while there are challenges, there is a lot of room for us to work with these mechanisms and strengthen them.
Get